So I think there's really two key facts, kind of loose consensus about the delivery system in the United States today. You can really is helped explained by two key facts about it. The first is that there's an enormous gap between what we know based on clinical knowledge we could achieve if the medical care system was operating at peak efficiency. That is, if providers and facilities could incorporate the best knowledge into their care. In fact, about 10 years ago, some researchers went out and compared for thousands of patients, looked at their medical charts and records, and they compared what was actually done in practice versus what the kind of minimal threshold would be if those patients were achieving minimal quality in their care. And what they found was that just over 50% of patients in the United States were actually getting high quality care. So what you also have is enormous geographic variation in the amount that the Medicare program spends on beneficiaries. The amount of treatment intensity varies dramatically across areas of the country. So if you take somebody of the same age, gender, and race or ethnicity in Miami and compare them to somebody of the exact same demographic characteristics as somebody in, say, Oregon, Salem, Oregon, for example, that beneficiary in Miami, the Medicare program will spend about $16,000 a year on that beneficiary, versus a very similar Medicare beneficiary in Oregon, the Medicare programs might spend $6,000. And so what we found, and like I said, the loose consensus among policy experts and health economists in the field is that the U.S. healthcare system simultaneously over-provides care that seems to be of low value, in the sense that we have these enormous spending differences across the country, but there's no real differences in mortality rates or patient outcomes or satisfaction of care, despite all of this variation. So we have a system that apparently over-provides care that is of low value and under-provides care that is of high quality.